My name is Janet Robinson and I coordinate Safetynet. Safetynet is a health network for homeless health services. Safetynet is a charity that provides specialised healthcare services for people who are homeless in Dublin, Cork and Galway. A key principle of Safetynet clinics is to make medical services accessible by locating clinics in the agencies and services where homeless people access for support and indeed live. The clinics are for people without medical cards and medical card holders whose GP is located outside of Dublin, and all services are provided free of charge. The service is described as Safetynet because it offers essential and accessible support to people who are homeless and who may not be in contact with mainstream services. The overall aim of Safetynet is to deliver the highest possible standards of healthcare to homeless people. The reason specialised healthcare services are needed for homeless people is because they have a higher mortality and morbidity rate than the house population. They have less access to primary care, including mental health services, and indeed only 26 to 46% of them in Ireland have a medical card. Homeless people also have a poor record of engaging with mainstream health services. So for all these reasons, this is why Safetynet was developed. Safetynet also operates as a network in partnership with the HSE, general practitioners and the voluntary sector. The aim of the network is to provide a professional support mechanism for health professionals in the homeless sector who are often professionally isolated. Safetynet membership is comprised of doctors and nurses working in 9 Dublin-based, 2 Cork-based and 1 Galway-based homeless service. In Dublin, homeless people can access primary health care 24 hours a day, 7 days a week. We provide evening and weekend cover through DDoC, North Doc and also the mobile health clinic. The mobile health clinic brings healthcare and harm reduction services to homeless people on the streets of Dublin City. It operates from a mobile clinic and is located on a number of sites on the north and south side of the city. We developed this service because through the work completed in the Safetynet clinics, it became apparent that we were missing a certain cohort of homeless people, those that don't engage with any primary care services. We then asked the Dublin Simon Community Rough Sleeper team and the Chrysalis Community Drug Project to join the service, because when we were developing it, it became apparent that we wouldn't be able to actually reach the homeless people. And the Rough Sleeper team and the Chrysalis Community Drug Project already have a working relationship out on the streets with the entrenched homeless and with female sex workers. So their role on the mobile health clinic is of primary importance because they bring the patients actually to the clinic. We operate the service using volunteer trainee GPs from the Trinity College Dublin and the Royal College of Surgeons GP training scheme. We do this because we want them to experience working with hard to reach groups with the aim that they may continue to work with this vulnerable population. The GP trainees are supervised by senior medical practitioners. In addition, the Dublin Simon Community and the Chrysalis outreach workers complete a range of harm reduction services with the patients. For more information about this service, please contact me on janet@primarycaresafetynet.ie or check out the website www.primarycaresafetynet.ie. We decided to train the nurses that we work with in the administration of Naloxone to enable them to reduce the rate of overdose deaths among their patients. The Naloxone training was provided by Dr. John McInerney, an emergency medical consultant in the Mater Hospital. The training was also provided in conjunction with our overdose policy, which outlines procedures for managing and responding to overdoses. For a nurse to be competent in the administration of naloxone, he or she must attend this training and must also have a basic life support qualification. 7 nurses in total completed this training course in December 2010. Access to naloxone has impacted positively on the services that we work with. For example, the nurse in Merchants Quay, Ireland would use naloxone on a weekly basis, sometimes up to 5 times a week. And the nurse in the Anna Liffey Drug Project has used it 6 times in the last year. The other nurses luckily have not had to use it, but they have told me that knowing they have access to naloxone gives them great peace of mind, because if someone overdoses in the service, they can do something to help the person while waiting for the ambulance to arrive. So naloxone basically facilitates early overdose intervention, and the nurses all view it as a safety blanket.